So I think I kind of hit on this here. So the services support and supports work better, and we're building family capacities. Priority needs, integrated plan, greater engagement and motivation. The family capacities that are really critical. There's a lot of different theories out there. This is the one that we kind of use in our training to keep things simple. You know, your job as a team is to really increase the confidence and optimism that the family, the caregivers can make, and the youth can make a difference in their own lives, and that you have people you can turn to when things get really challenging. All right, so try and save at least a couple minutes for questions. Outcomes of Wraparound to date. We've gotten a couple NIH studies, one just concluded. We've reviewed 9 controlled published studies to date. The majority were published in the last 5 years. And what we see are, one thing you have to recognize is Wraparound is implemented for so many different types of kids, so many different types of populations, that even though we have 9 studies, unlike a lot of treatments where the outcome of interest is the same for every study, you know, this is like, you know, you've seen one controlled Wraparound study, literally seen one controlled Wraparound study. So we see studies that are looking at mental health outcomes. We've seen studies conducted by our own Mike Pullman here in the middle of the room that look at juvenile justice outcomes. We've seen, as yet unpublished research from Oklahoma that have found that when you take child welfare caseworkers, reduce their caseloads, train them to do this process, you get kids to permanency much faster and with greater consistency. Okay? And that's actually something that it seems as though the secretary of our Department of Social and Health Services is now really interested in trying to figure out how to do more consistently, is to use these kinds of processes in children's administration. Yes?
So my question is, so I'm understanding this right, sorry, are they saying that they're trying to, for each system, that they would have their own wraparound, like you said, smaller caseloads, that they would have their own wraparound because they know their own system and they know
Very
it's available,
right.
and for instance, like DVD having your own wraparound.
So that's the challenge, right? I mean, ideally what you have are systems all contributing their resources to a pool of funds that allow kids with complex needs, regardless of what system they're being touched by, to have that kind of integration of effort. And that's always the ultimate goal. The best example is Wraparound Milwaukee, right? You've got Medicaid, mental health, juvenile justice, schools, and child welfare all contributing tens of millions of dollars into a pool that serves 1,000, 1,200, 1,500 kids a year. It's unideal to have Wraparound wind up recapitulating the siloization of services. You don't want to have silos of Wraparound.
No.
But ultimately, that's what a lot of these studies are looking at, is we have a Wraparound program. It's a pilot project. We serve 50 kids. Here's the outcomes. We compared them to regular services as usual. And typically you see, whether it's adult prisoners, child welfare, mental health, juvenile justice, you see better outcomes in the published control stuff. But it's a very good point. If we had a lot more time to talk about financing and system issues, that would be something we would describe as how you actually create cross-system integrated wraparound. So, you know, we don't have a lot of time to get into the details. Here's Mike's study. 3 times less likely to commit felony offenses compared to a historical match comparison group. Small pilot study in Nevada that we built on with our recently completed NIH study. Much greater reduction in functional impairment. We did a meta-analysis which found significant effects. The strongest effects were for this living situation outcome. Probably not surprising, because that's where you're really focusing more effort than is typical with the family and the caregiver and the parents to be able to care for these kids in home. But we also found significant effects for mental health, school, and juvenile justice outcomes. And the thing that's interesting is that the average effect size is about 0.35, small to medium, but that's about what you see in the literature for established evidence-based treatments compared to some sort of alternative condition. So we think it's pretty consistent with the standard that's held up out there for effects of evidence-based treatment compared to some sort of alternative. We find that outcomes depend on the quality of implementation. Things that should happen, all that good stuff I described, often doesn't. And if it doesn't happen, you don't get the same kind of outcome. Wraparound initiatives and provider staff with better fidelity are getting better outcomes for their kids. And so we really are emphasizing high-quality training, coaching, and supervision, and communities, as was suggested by the question that just came up, that really have developed supports across all of the systems to work together. So community partnership, working together to figure out the fiscal piece, developing, blending funds to develop a really responsive service array that includes supported services as well as evidence-based practices, and good training and coaching, and an accountability system. And this is where the work we're doing is really complex and it's going to keep me employed for a long time, because all of these factors, we really still have a lot of research to do to ask which of these system, program, and treatment factors are the most important. That all aside, I've got 1 minute left to absorb some places that if you were working with kids in these different counties that you think might benefit from this. In Washington State, most of these are fairly small projects. It certainly is not statewide. It certainly is not cross-system in any individual RSN or county. But there's a kind of bubbling up of more and more of this good work going on out there. And some of them are really incredibly locally innovative, like down here in Benton and Franklin counties at Three Rivers Wraparound. Here in King County, the mental illness drug dependency 0.1% sales tax behavioral health dollars are supporting 300 to 400 wraparound slots delivered by 5 different provider agencies in the county. And so you can go to kingcounty.gov and find information about how to get kids referred there. There's also a homeless youth wraparound in Seattle that's administered by Catholic Community Services and University District Youth Center. But again, small pockets of innovation around doing this kind of model in different parts of the state. And I don't know, if we have time for one question, I wish I could take that. I'll leave it at that and leave that up there, but questions? Yes?
Are there any of these local programs or ones across the country that have maybe turned up the volume on the community level of the intervention, just where refugees, immigrant communities, and sort of the lens on nuclear families?
Right. So that's I think an ideal situation for these wraparound projects is to really engage community-based organizations that might be relevant to support for the populations that we're working with. So if in fact you are working in a county or a corner of a county that does have a large immigrant or refugee population, how are the people at the top levels of this effort engaging those folks and making them part of the effort? And I think that for instance, the King County one is just kind of getting going. I'd like to think that they will figure out ways to kind of build that really community-driven wraparound over time. But that's kind of rarefied air when you get a sustained project that really got that kind of going on. But I think it's what a lot of these wraparound projects are working towards. Okay.
How do you get your LinkedIn with wraparound? Yeah.
How do you get linked into wraparound?
Can I get referrals?
You can make a referral to that. In King County, you can make a referral to that phone number. They are supposed to be serving kids who have a diagnosed mental health disorder as well as multiple system involvement. Those are the two main things that make you eligible for the King County Wraparound program. And it's really just getting off the ground, but they are serving 300 kids at this point. And we've got high hopes for them over time. Yeah.
So what do you do in a situation where I know the family has to be bought in, but if there's a lot of conflict within the family? I mean, are there services where if a youth wants to do it, but maybe a parent doesn't? What do you recommend? Maybe that's
well, the idea is that this facilitator knows well enough the resources in the community and is skilled enough to really be able to kind of negotiate where's the best place to start. With whom, what's this team consist of? If you can't have everybody who might be relevant there right away, you bring them on over time. It's really a lot about the skills of the facilitator and the resources that they have access to. There's no real kind of stock answer, and that's kind of part of the idea of wraparound is to individualize it to each family's situation. We have time?
I just wanted to say something really quick. Tana and I, we have teams here who do wraparound in King County, so we have our business cards if you guys have more information or would like more information. I don't know how much time we have.
Where are you from? Which
Center for Human Services and Sound Mental Health.
Awesome.
They're 2 of the 5 contact agencies.
There it is.
So we have information on how to make referrals. Anyone can make a referral.
folks to come talk to if you've got you're working with and families that might benefit from this. Like I said, we've got real high hopes for King County really taking those sales tax dollars and making it out. Is that all right?